Thanks, Michelle, and thank you for the presentation today. And thank you for all the good work that you're doing. I suppose the first question I want to ask is, when will the programme be approved by the EU Commissioner? When are you expecting it to be approved? And how time sensitive is that? Is there risks there if it's not approved sooner rather than later? I just want to ask you as well, in terms of how successful were the health and wellbeing programmes which was set out to train the 40 local community health facilitators recently to deliver the healthy lifestyle programmes to the residents in their communities, and what areas were those delivered in, and how do you evaluate them? And just on, one of the biggest challenges we have in the west of Ireland and in rural Ireland is the shortage of GPs. How is that impacting on what you're trying to do as well, and what do you see are the solutions to those? And maybe, I don't know if you're involved in the associate physician developments, maybe you could just speak to that as well. I want to give you time to answer, so I have other questions.
There's 8 minutes left in the slot. Yeah.
Maybe I might just take a broad on a couple of points that my colleagues Bill and Neil would come in as well. Just in terms of the learning, in terms of back to the government departments and the ministers, I suppose our role is very much, we're comprising of the partners that deliver care on the front line, but we work closely with the departments in terms of trying to influence policy. So the other point actually on the Interreg projects, the EU projects, there has to be an element of innovation, so it can't just be doing what you're doing. So we're always sort of, I suppose, trying new things. If we just give you one example to illustrate it, community paramedics was a new development which Bill would have spearheaded in a former role, that the ambulance services were paid, they could go out on call from GPs or from 999 and weren't obliged to necessarily take patients to hospital. They were trained to a higher level, and that was piloted in Donegal, Monaghan, Tyrone, and also working with Scotland. The training and education was actually done in Scotland, so it was a really innovative type of project. So what we would do is we take that sort of learning back into our respective sort of service planning or annual processes then with the departments if we feel it's been successful. And I'll ask Bill maybe to talk on the evaluations and some of that in a moment. Just on the timelines then in relation to the Peace Plus programme, we're fairly confident. We don't have a specific timeline on that, but in talking with the SEUPB, their CEO, the Special EU Programmes body, they're confident that we will be moving to calls at some stage later this year. So we've actually been doing a huge amount of work to try and build up what we see are our priorities along the border region with both colleagues in Northern Ireland and in the Republic, to look at how those joint projects can work. And they might be initiatives where patients move, or clinicians move, or just where there's learning between the two jurisdictions of doing something together and learning off each other, even though they both may have different regulatory positions and so on. So we'd be optimistic. We don't certainly see at the moment that that will be an issue for us. We don't have an exact date, but certainly talking to SEUPB, they'd be confident that we'll probably be going for calls later this year. And we've been working for the last 12 months, believe it or not, in trying to build up those proposals, because it takes a huge amount of time to get all the partners to the same place, make sure the priorities are the same, make sure that there's good clinical buy-in, good support around it. So there's a huge amount of work which Bill and the team would facilitate between the partners. And I would have worked, I'm working the HSE. So again, we know that those things take time. So we've been working actively on those for the last 12 months. I might ask Neil just to talk about the Western Trust. He probably has a closer handle on that than I will, just to respond to that piece. And we'll come back to just some of the other questions as well on GPs and health and wellbeing. And I might ask Bill to come back on some of that.
Certainly, and Michelle, you'll be well aware that our Hearts, Our Minds programme is not part of the COT programme. It's a separate transformational project that's been delivered within the Western Trust. Our priority in that is try to convince our funders in Northern Ireland of the merits of that. So, I can confirm that the Western Trust has shared both the benefits and indeed the service impact and post-project evaluation with all trusts in Northern Ireland, and indeed the Commissioner and the Department of Health. I think it's important we do that before we start trying to spread it across the border, because really it's as we've already been told, it's all about innovation, and we have to prove that the innovation is spreadable before we can actually just look to bring it across borders. So that's our Hearts, Our Minds. We're still looking for the funding for next year, so any influence you can give, Michelle, we will obviously appreciate. In terms of physician associates, yes, we have piloted that in the Western Trust. Indeed, my previous employer, the South Eastern Trust, we've been piloting physician associates. I think it's too early to say whether it is the overall solution to either GPs or indeed shortages of consultants and middle grades and indeed juniors in hospitals in Northern Ireland or indeed the South. For me, it's really, really challenging. The recruitment of qualified medical staff be they GPs or consultants. The physicians associates, the jury's still out in terms of the impact that will have. We are committed to the programme, and we will see at the end of that whether or not that will be the answer. It's certainly, I think I see it as a part of the future. If we can define the role really well and define what element of the medical service that they deliver, to as much as anything to reduce the workload on our consultant workforce. In relation to shortage of GPs, Michelle and I have had many conversations regarding the shortage of GPs, particularly in rural areas. It's a problem that is common for Northern Ireland and the Republic of Ireland, so that's clearly something that COT can link into. We struggle for the solutions. That's the innovative side to it is really the challenge, to try to find the answers to that. But where we have a common problem, COT can be really, really influential and really, really helpful in terms of helping us solve common problems.
That's great. And just how important do you think cross-border enrolment is for students? We're doing a project in the moment on that and examining opportunities, training and education opportunities across the island, that we have a shared approach to that.
Well, I'm flying the flag for the Magee Medical School, and everywhere I go, I'm really, really proud of the innovation and the development within Magee, and I would encourage all communities to sign up to it. And actually, I see that as really helping us create a corridor, and in terms of the future for the medical workforce.
Yeah. Okay.
And just maybe I might add to that is that the work on the indemnity, for example, those things are very important to enable people to move, whether it's in a student capacity or in other capacities where people can work across, particularly in areas of specialisation. So what's really important for patients, perhaps, where you look at a larger population, and for example, Bill can talk to some of the initiatives that aren't COT initiatives, but COT would have facilitated, such as the PCI, where people, who have cardiac arrest and so on in Donegal can now go into Altnagelvin and get immediate treatment, which wouldn't have been available heretofore. And there's several hundred people's lives who've been saved as a result of that initiative. Now, those things take a long time to give effect to both the regulatory, legal, operational and other considerations. So just the other question, I think I might ask Bill to respond on the health and wellbeing development and the evaluation.
Yeah, the health and wellbeing, that co-sign project has successfully closed. It reached its full targets of over 10,000 beneficiaries. And your specific question was around the community facilitators. Yeah. The target was 40 and we actually trained 60. Right. So we exceeded that number as well. With the support, obviously, of the SUPB through some very difficult times through COVID. We've had to go for a number of requests for change to our delivery model, our timelines, and the targeted community that we were trying to reach, because a lot of these people then weren't engaging, and we had to look at new platforms of e-health and telemedicine to bring those targets and bring those beneficiaries up to what we had promised that we'd do. The Peace Plus piece, we're working very hard with all the strategy groups north and south to give you reassurances that we believe that funding will be called in 2022. And we're working tirelessly to bring that to a phase of complete implementation. We don't see that will be deferred any later than the end of 2022.
Just one other point about that on the evaluation is that under the EU rules for the programmes, there's very stringent evaluations needed. So each of the projects will have a formal evaluation in terms of what worked, what didn't work. And I suppose one of the things we try and learn from is that with innovation, everything can't work. Some things will work, some things won't, and it's important then to understand what you might do differently. And just to illustrate, I suppose, because these are innovative projects and only running in small pockets, and it links back to the earlier question, what we do then is each jurisdiction, if you like, has the responsibility then to see what do they want to bring forward. The programmes have a certain shelf life, they're only funded for a certain number of years. But in the last round of funding, the previous programme, over 80% of the projects were what we call mainstreamed. So in other words, say it was a disability project in Donegal, that was brought forward then on a wider scale, both within that local area and then potentially, obviously, if it's very successful nationally. So you'll have seen, maybe I mentioned one of the projects on mental health, the Recovery College, where you use people who've had lived experience of mental health to work with other people. That's an innovation, and then that's been used in other parts of the country. For example, there's a really good example of it in Kilkenny that I've seen from another experience in another role. And again, that has worked very well for us and is still going through. The project is still running in both jurisdictions. So there's a very stringent evaluation process under the EU programmes, and one of the key things that the COT office, Bill and the team provide, I suppose, to support us as the partners to try and facilitate and broker that and support that sort of project management and things that maybe people wouldn't have capacity to do otherwise in the services, because as we know, the health services in both jurisdictions, the one common trend is that they're both under enormous pressure, demand is very high, so having that support of people who can help those projects to go forward and still meet our obligations to the EU is really crucial.
Great, thank you very much.
Thanks.